Welcome to Faith Positive Radio with Dr. Joey Fawcett, the Christian business coaching conversation that increases your faith with greater joy at work so you love God and others more. Dr. Joey interviews Christian business professionals just like you to discover their secrets for working faith positive in a negative world. Welcome to Faith Positive Radio with Dr. Joey Fawcett.
Hello, Faith Positive Nation. Dr. Joey Fawcett here with another episode of Faith Positive Radio. Thanks so much for listening there at my last count, 1,259 bazillion, 439 podcasts out there in the world. And you, either through God's providence or just sheer serendipity, found this one and this episode. I promise you will be thrilled that you did. Has your personal life ever, I can't say predetermined, but heavily influenced your professional life? In other words, the career choices that you made, how has your personal life informed those? You know, typically when you ask college students about why are you majoring in blah, 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 they say, well, I had a high school teacher in blah, blah, blah that was really influential on me. The same thing applies to our families and our growing up years, but also when we become adults and we begin shaping and forming that career to which God has called us through our divine design. Today's guest absolutely, positively has an enchanting, enthralling story about how his family life, that is his wife and their adopted children, helped shape and form him. And it has to do with an area near and dear to all of our hearts, because if you haven't been to the doctor recently, you will be going, right? If nothing else, to get a COVID test or to get a vaccine so that you can go back to work real soon, right? And so the world of medicine has changed dramatically, not just in the last 12 or 13 months, but over the last decade or two, medicine has changed. And so some of those changes have affected the way that we receive medical care, but they also have put the onus on us in some ways to be advocates for our own care. And ironically, today's guest is a medical doctor who found himself in the business of advocating care for a daughter that he adopted. You're going to love meeting my new best friend, Dr. Aaron Hartman, today. Dr. Hartman, welcome to Faith Positive Radio.
Dr. Joey, it's great to be here. Thanks a lot for inviting me to talk with you and your audience.
Oh, we are delighted to have you here. So tell us this enchanting story about how you, as a medical doctor, along with your wife, adopted children, and those children and your experiences with their need for care shaped your career as a doctor.
Well, it kind of started, my wife and I had been married for about 2 years, and my wife is a pediatric occupational therapist whose field of expertise is kids with special needs. And our first daughter, Anna, was actually one of her patients, had just gotten out of the hospital when she was, at 6 weeks of age, with cerebral palsy, had a lot of just, crazy birth history. And her foster home was closing when she was about 12 months old. And so she asked me, hey, do you want to adopt this little girl and bring her as a foster care? And so I was like, well, sure, why not? Foster, my thinking was you could always give her back if, things don't work out.
So there was a finish line there for you.
Yeah, well, again, things changed, and so I kind of fell in love with this little girl. I just started taking care of her and just, the initial thing with me was, my faith, true and undefiled faith is the care of the widow, orphan, stranger. And so do I really, there's this orphan put before me, if I really, and for me, it was more like, very mathematical. If I believe this, then I do that. So we just did it. And then the process of doing, I slowly fell in love with my daughter, Anna. And I think the trajectory that changed my medical practice at that point in time was we had Anna for, maybe it was actually in the beginning, the first time we had her, and she has cerebral palsy and she wasn't gaining weight. And I was working on feeding her, spend, a lot of time trying to feed her every day. And the pediatric GI doctor wanted to put cut a hole in her stomach and put a plastic tube in so they could pour formula in to make her gain weight. And my wife and I talked about it. We talked about how that affected her speech, how it affected her walking and crawling. And at that point in time, she was supposed to be a vegetable. She was never supposed to talk. She was never supposed to walk. She couldn't sit up by herself. When she was 2, she said one word, which was hi. And so,
good word.
Yeah, it was a good word, but that was it, and so, the medical, specialists didn't have a whole lot of, expectations for her, but we had greater expectations. My wife said there's something there. And so we just opted not to put that feeding tube in and just to work hard to feed her. And the thing about the story is that 6 months later, my wife found a growth chart for kids with cerebral palsy. And my daughter was right in the middle.
Wow.
So the specialist who said she was underweight was using a normal growth chart. When you got the appropriate growth chart, she was fine.
Kidding.
No. And so the same thing happened, 6 months later with an ophthalmologist saying she has strabismus where her eyes kind of wobble around. And and they said, let's do surgery to fix this. I'm like, wait a second, you can't predict where they're going to go. Why would you cut anything? Saw another older ophthalmologist who said, yeah, why would you do that? Just let it play out and see what happens in a couple of years. And that was the beginning of me starting to question medical authority. As a doctor who has a field expertise, I started questioning things. And so we started diving into gene research on how genetic expression with health issues, going down that pathway, got drawn into integrative and functional medicine where we do advanced biologic testing to figure out different infections and nutritional issues to address. Started studying medicine in other parts of the world, in Germany, where they use electromagnetic field energy to treat muscle aches and pains, joint issues. Went to Canada, actually took her to Canada to do PONS, which is actually just got FDA approved 2 weeks ago to treat gait issues with multiple sclerosis. I was looking at the literature in Russia using it for kids with CP. So we went up to Canada and we just kept on doing this and pushing the limits. Doors would open, we go down pathways. And now she's turned 15 yesterday.
Really?
And and she's walking with forearm crutches. She won't stop talking.
So she says something besides hi, I take it.
Oh man, she loves her jokes. She loves playing games. We just started hyperbaric oxygen therapy with her.
Oh, sweet.
About 2 weeks ago.
How's she responding to that?
We actually have seen her just in the last week. She's actually thinking more like with games. She was only thinking 1 or 2 steps out. Now she's thinking 3 or 4 steps out just in a couple of weeks. And so we've always just, felt that, there's something more for her. And we've never let any barrier, any specialist, any person say, you can't do this for your daughter, which seems kind of silly thing to say, but you hear that all the time. And kids with special needs, it's really weird. You have this group of people that are uniquely disadvantaged and vulnerable. And the group that also gets abused by the medical system more than the other group, It's just really heartbreaking to see what happens to these kids. And so just for us to, as my wife being a pediatric OT, us being a doctor and seeing our struggles with navigating it, I just realized, if I can't navigate this, then who can? Yeah,
because you guys are insiders, right? You're supposed to know how to make it happen.
Pretty much, yes. So that just changed my career field, because as I biohacked my daughter, and changed her trajectory, I'm like, well, why can't I try it with patients in my office? So I started seeing people with neurological issues, and they started getting better. One of my patients actually, he had a throat cancer, and so one of the treatments was head and neck radiation and chemo. And he developed really bad nerve damage. It's called peripheral neuropathy, pain hands and feet. And so, so I did a organic acid analysis on him, saw his nutrient deficiencies, fatty acid things, did a bunch of stuff with him. And 6 months later, when I saw him back, he forgot he had peripheral neuropathy. It went away. And so you see that
6 months.
Yeah, you see that 2 or 3 or 4 times. Yeah. You see, all of a sudden you're like, wait a second, am I crazy? Like, I still sometimes ask myself, am I crazy? Like, am I really doing the right thing? And
you may be, but that guy thinks you're a hero.
But you look at the Cleveland Clinic, which has a functional medicine clinic there. I'm like, well, they're pretty reputable. They have the biggest functional medicine clinic in the U.S. is actually at the Cleveland Clinic. You can Google it. You start realizing the top 2 the top 2 functional GI doctors are ones at Harvard, Dr. Fasciano, and ones at Hopkins, Dr. Mullen. So all of a sudden, it's like, how do you integrate all these experts into a application functionally for the people that are in front of you? And that's where I think this whole thing with COVID, for example, I've been taking care of long haulers, people with long COVID, since last year, and just started entering the news media 3 weeks ago. I was already talking about these people and seeing these people last summer. So all of a sudden, people realize this is the kind of medicine people want, is cutting edge, individualized, individual-centered, patient-centered care that doesn't just wait for an organization, institution to say, you can practice this now, that actually looks, what are they doing in Germany? What are they doing in the UK and Ireland? What are they doing in these other countries? And are these interventions safer than what we're doing here? And why can't we do these? And so that's kind of how functional medicine's kind of changed my, the trajectory of my family, as well as my clinical practice. So.
Man, what a fascinating story. So yeah, you also have a seminary degree, right?
Correct. Yes.
So tell me how medicine and your faith combine and express themselves in functional medicine.
So I think the underlying, the if you believe in God, you believe in this idea of an infinite whatever, infinite wisdom, infinite expanse, etc. If we're made after the image of said infinite prime mover, then the expectation is that our biologic systems should be infinitely complex. The idea of, Darwinian thought that you know more than your genes is really funny. I was in medical school in 1996. You are no more than your genes. 80% of cardiovascular disease, cancer, it's all genetic, right? We're gonna map the human genome and cure everything, right? We haven't cured anything. And we realized, well, this is.
I'm still eating a gallon of ice cream every night. I'm not.
You probably shouldn't be doing that.
Yeah.
We realized that actually, genetically speaking, you have about 23,000 genes in your body. There are frogs that have 50,000 genes.
What?
There are nematodes that are as genetically complex as you.
Oh, wow.
So what makes you special? That
I don't feel special anymore. If a nematode has more genes than I do. Maybe we're more efficient with our genes as humans, right?
Well, actually, no. What happened when it comes to good try.
Here, Dr. Hartman.
I'm trying to. Well, so there's this thing called the epigenome. Okay. What it is all of a sudden we've learned that there's 1 million genes in the bacteria in your gut.
Okay.
And these genes, change the expression of your genes. They modify the expression of your genes. The reason we're so complex compared to nematode is because we have this other world living in us and on us that affects our genetic expression, so that humans, we can live anywhere in the world. Our environment's not limited anywhere. This
it has to live in a specific environment. That frog has to stay in a specific environment. Okay.
And so we now learned that Alzheimer's and Parkinson's actually start in your gut 20 to 30 years before diagnosis. We've learned that inflammation is the primary cause for chronic diseases, and 90% of your immune system is in your GI tract. We've learned all these. So what we're learning is that you are, this is an analogy. I could talk about this for a little bit, but you are.
I get that sense.
Yeah. But like, if you think about the infinite complexity of everything, the earth has this stuff called magma. It's like liquid iron that moves, that creates the earth's electromagnetic fields.
Sure. And
they pulse at this thing called the Schumann force, which was 7.83 hertz, which just happens to be the same frequency of all mammalian alpha brainwave activity. And if you take
hang on, let me soak with that just a minute. So the Earth's magma moves at the same frequency as our brain waves.
No, the Earth's magma movement creates the electromagnetic fields of the Earth. So you look at your compass and you see it shake.
The electromagnetic fields are at the same frequency as our brain waves.
And so if I take you and put you in outer space as a cosmonaut,
your
muscles get thin, your bones get thin, you come off,
come
6
away
months
from
later.
That vibration.
Yeah. And so now we're using that energy to treat diseases, depression. There's actually a device used, FDA approved, to treat depression. All of a sudden, your mental health, your physical health is intimately tied to the Earth's electromagnetic fields. So where the faith thing comes in, if I hit something I don't understand, if I believe we were created for health, we're designed for health. If we're self-healing, then if I hit something that I don't quite understand, like my daughter's cerebral palsy, my son's allergies, we have another daughter, she has cerebral palsy as well. My wife's health issues, if my underlying presumption is we're designed for health and wellness, your body wants to self-heal. There's this infinite complexity, this untapped ability for your body to self-heal. Then I don't just accept the status quo of, I'm sorry, you have chronic fatigue and fibro, there's no help for you. There's nothing you can do for COVID or long COVID. Sorry, I don't accept that, because that's not part of my DNA.
So what you've done is you've shifted away from an illness model, which predominates the practice of medicine today, to a well-being model, believing that we are created in the image and likeness of our Father, who is infinite, right? And so we can work towards that well-being as opposed to treating illness.
Well said.
That's amazing. Oh, man. Let's just soak in that for a second, Faith Positive Nation, because so much of what we do and what you and your wife, even as insiders, were butting your heads against, right? Slamming your head into that wall was that illness model, because they wanted to treat her as the average, the norm. And then I'm sure there was a pharmacological response, right? That's typically what we do. What do we go to the doctor for? To get pills, right? Or something like that. But what I hear you talking about are using ways that are more in line with the way the Father created us. For instance, the resonant vibration.
And there's so many examples of that, and a lot of these things like PEMF, for example, was used in Poland, Russia in the 60s and 70s. So the actual, the NASA spacesuits, actually, they developed pulsing electromagnetic field devices in the spacesuits to actually decrease the loss of muscle mass and strength in astronauts in outer space.
So it's mimicking
exactly. Yeah.
Wow.
Yeah. And so to say that, you might be like, well, you're kind of, there's actually, I got a book up on the shelf here somewhere that's actually in that right there, electromagnetic field imagery. It's basically the textbook looking at the study of electromagnetic fields in medicine over the last 40 to 50 years. And so once you realize that, even it's interesting how different ethnic groups, different nationalities, people of origin look at science differently. Adaptogenic herbs is a great example. Ashwagandha, astragalus, Siberian ginseng, these things that people might know what they are now. The Russians have been using those to heal from training since the 60s. They were using these back in the 60s and 70s, the whole Rocky thing, the ultimate Russian, machine. They were,
now I got the theme song running through my head. Suddenly I want to run steps.
Yeah, exactly. Well, you have all the machines and stuff, the timers.
But what they did, where are my eggs? I need to crack some eggs in a glass.
Have to be raw, right?
Yeah, not that I've seen the movie a few times.
But the point is that, but they were actually in the 60s and 70s using adaptogenic herbs that actually allow your body to heal quicker. Cold ice baths, which now everybody in America remembers the Sochi Olympics where the skiers were hopping the ice baths. They were doing that in Russia and Eastern countries decades ago. I mean, so all of a sudden it's like human knowledge and wisdom is always expanding. Why can't I try to tap into that to help my daughter first, to my family, and it just bled into my practice of medicine.
Right, and it became functional medicine. So where does that? Well, obviously, and thank you so much for making that faith connection for us, because what I hear you doing is tapping into our Creator's purpose for us, and that is for well-being, right?
Yeah, exactly.
He created and declared it all very good, so we're created for well-being. So thanks for clarifying that for us. And I'm assuming that the phrase functional medicine is rooted in that created order of well-being within us, and that's what you're trying to move towards, away from an illness model. There's different good.
That's fair. Yeah. There's different terms for it. It was called holistic medicine probably 20 or 30 years ago.
I remember that.
Then it was called integrative medicine.
I remember that.
Functional medicine, that movement started probably in the late early 90s. An Institute for Functional Medicine launched, I think, in 91, 92. And it's a different, you could call it a lot of different things, but the idea is that you have this model of healthcare, chronic healthcare, that's based on foundational principles of diet, lifestyle, exercise, sleep, nutrition. It looks at, your health status as a timeline of your history, where you lived in the country, environment. And the center of this are your current symptoms, which is pretty much where most acute care medicine sits, is just the symptoms. But then within that is this mind-body connection of you, that your spirit, soul, body kind of sort of, they use the mind-body connection is at the center of all this. And so, it's truly holistic, whole person care. I tend not to use the word holistic just because, I grew up thinking it meant crystals and smoking herbs and all kinds of weird stuff, but it actually is, exactly, but it's actually much deeper than that. I call it deep medicine. It's deep.
Yeah, deep. Yeah. Get our best Barry White voices out here. So functional carries a certain distinction to it. And for you, what's the difference over, say, holistic or integrative?
I think it's just the popular term right now. If I was to actually pick my term, I'd say holistic, because I feel like that's holistic means like I look at acupuncture, I look at herbal medicine, I look at chiropractic. But I try to but with a functional perspective, you look at where's the data in the literature, because there is data in the literature for functional neurology, acupuncture. I have a lot of patients with gastroparesis, or their gut kind of stops working, and acupuncture can actually help to activate your nerve system to re-engage your gut system. So there's actually literature in these things, and then the functional aspect also looks at healing traditions. So like in Ayurvedic medicine, for example, they were 2500 BC using ghee to treat neurological disorders. Well, now we know D as a food has the highest concentration of butyric acid, which is this short chain fatty acid that you need to heal your gut and your brain, like the blood-brain barrier and your gut lining barrier, which is they're very similar barriers. Actually, the butyrate actually helps seal that. So now there's actually data for why that treatment may actually have helped in the patients with Parkinson's back over 4,000 years ago. So that's where I think, having your hand in science, but not being limited by science. I think it's part of things, with the whole COVID thing. What's your randomized, double-blind, placebo-controlled trial for vitamin D? Well, there's actually not one right now, but all the other literature is so strong not to take a nutrient supplement. 87% of people who have died with COVID have low vitamin D levels. It's kind of like, well, just take some D. It's not going to, if you check your level, get it up. There's so much literature on, right? Well, it's like there's so much data on low D being associated with an increased risk for infections, cancers, cardiovascular disease, autoimmune disease, and in the flu literature, there's actually information on D levels low levels increasing your risk for severe flu. And now we have a lot of stuff on the COVID thing, but the traditional model would say you have to wait for the committee to have a randomized trial to see you can do it now. And and that takes 15 or 20 years. Typically it takes about 15, 20 years at least.
Everybody who was interested in it is dead by then, right? Yeah, Dr. Aaron Hartman is a medical doctor. You can go to richmondfunctionalmedicine.com. And if you happen to be sitting by a laptop or an iPad or something, you can check it out as we're talking right now. He's my guest today on Faith Positive Radio. So I love, again, the interconnectedness between the faith dynamic and understanding better the way the Father made our bodies, so that we can really take collective literature from thousands of years ago, right, and bring it up to this point rather than trying to recreate and make up a pharmacological response. But the challenge is that average people like myself and our family, right? If it was the challenge is, if it's difficult for you and your wife, who are medical insiders, to advocate for your daughter within the system, how in the world do people like us push back beyond just going to the doc and getting a script?
I mean, that's where you have to be your own advocate. You have to kind of know.
How do I do that?
I mean, first you have to believe. Do you believe there's something bigger? Do you believe there's a greater purpose for healing? Do you believe that actually food is medicine? I mean, I think the most basic principle goes back to Hippocrates. Let medicine be that food and food be that medicine. That's a starting point. That's like the starting point for functional medicine. Do you believe that what you put in your body is the ultimate medicine to keep you well? And I could talk about, the literature from the University of Florida, that half of all chronic disease in our country can currently be attributed to eating processed foods. The Harvard School of Public Health with Walter Willett, who's like one of the top epidemiologists in the country. 80% of heart disease and 7% of cancer can be attributed to diet and lifestyle alone. So do you believe that?
80%?
80% of heart disease and 7% of cancer
can be attributed to
diet and lifestyle alone.
To diet and lifestyle alone.
Yeah.
So sedentary lifestyle and a processed food diet are killing us.
Yeah, pretty much. And that's a starting point. If you're not there, that's where you have to start. You have to start with food, and then you kind of work your way out, because the foundations are, sleep, exercise, et cetera. And that's where, if you need a guide or a help, I've actually set up a community online to actually help guide people through this.
Really? Tell us how to get there.
Where you just go to the website. It's actually on the landing page.
Okay.
I've got a community link and then like a clinic link.
Okay.
So one of the things
richmondfunctionalmedicine.com.
Yes, sir.
That is, by the way, Faith Positive Nation, that's on Dr. Hartman's page at getpositive.today. Just go in there and search for Dr. Aaron Hartman and you'll come to his page. And we've got richmondfunctionalmedicine.com right there for you if you're walking the dog or something. So there on your website, we'll find
the information to click, information about the community if you're interested in that. But that's like my response, my personal response to how do I make this personally available to people? Because it's all basic education. You have to learn about how do you pick your food, how do you figure out if your environment's clean, how do you work on your sleep, relationships, like the basic stuff. How do you walk through self-realization of what your triggers for illness may be? Because that's the other part of the functional medicine, is figuring out what may have triggered your illness, what may be, mediating your illness or maintaining it, and how you can use those leverage points to improve your health. And so people, the point of the community is actually walk people through that individually. And I've got I've got a nurse practitioner and a whole online community that actually answers people's questions. And I kind of got it with courses. So that's my response to how people, there's books on my website. I've got a whole reading list that people can, if they're interested in gut health. Dr. Jeffrey Bland, actually, who's considered the grandfather of functional medicine, has a book called The Disease Delusion. And
so I'm not, think I'm sick.
Well, the point of the book is that we look at diseases being, I've got pneumonia, I've got bronchitis, I've got diabetes, and that's the acute care model, like you mentioned before.
Right.
But the chronic care model is it takes you 10 to 15 years to become diabetic.
Okay.
If you develop heart disease, your fatty plaques start in your teens and early 20s before you have that event in your 50s or 60s. So the idea that disease is this linear, once in a lifetime event is a delusion. It's not real. It actually starts years and years and years and years and years and years in the past.
Well, Dr. Hartman, are there things that I can do now to begin to reverse some of those things that happened to me earlier in my life to create a better sense of well-being?
Absolutely. Yeah, that's the whole point of functional medicine, is to individualize a care plan so that you can change your health trajectory.
So how do we discover what I need to do specifically to me?
Specifically to you? Well, you can come see me in my office if you want.
We live in the same state, so
you can drive 3.5 hours. It's not that.
Yeah, let's say somebody in Wyoming, my friends in Wyoming who are listening to this. What can they do?
I think the first thing is you have to kind of believe in this. Do you believe you can change your health trajectory? If you're not quite sure, if you're listening to this and it sounds kind of weird, just go to the website and check out some of the education materials. I put that stuff there.
Even to back up just one step from that, I got to believe that I'm a son or daughter of the Father who created me the way that I am, and that there's infinite love for me that went into creating me who I am. So I am worthy of treating this temple, right?
Absolutely.
In a way that creates well-being so that I can love God and love others.
I mean, do you believe you were made for health? You were designed for a purpose. There's a plan, and that plan, that's when the illness, if there's a plan for your life, one of the things that illness does is it robs the ability of you to fulfill that plan for your life, and so if you believe that, one of the things I've always wanted to do is be a part of some grand narrative, some meta narrative, something greater than myself.
Sure.
If you believe in God, then that's part of your design, your makeup, is to have, all of us. It's interesting. All these stories, Lord of the Rings, Harry Potter, pick any ancient story. There's all this narrative of this greater grand plan. It's kind of built into our DNA. And if you believe that for yourself and you have health issues, is this the way it's supposed to be? Or is this a part of a result of the fall? And if it is, then maybe, just maybe, there's a way for you to use the general grace that's given to all men to overcome that.
Oh, I love the way you said that. A way to use the gentle grace to restore our broken nature. I love that. So just as Christ died for the redemption of our sins, we have ways of redeeming our bodies through Christ's help as well. Oh, I love that. Once again, and I don't know that I've ever repeated a website this many times in a show, but anyway, because I'm itching to go there now. RichmondFunctionalMedicine.com. And you've got a contact form there, so we can send our questions to you, Dr. Hartman. You also said you have a nurse practitioner there who answers questions, and there's a community of people. So when we go there, what are we going to find? People sharing their stories?
Yeah, that's one of the things we kind of realized with the whole COVID thing is we need community. One of the things people are starving for is community. It's, there was this study that Rick Warren's church out in California with Dr. Mark Hyman did this study with the weight loss study. And they saw that people that were in a community, a small group basically focused on bettering their health, lost 20 pounds more on average than those who were doing it by just being, and that's one of those big pushes with medicine now, just being in community, just sharing your story, lifting each other up, bearing each other's burdens, kind of like the Lord of the Rings, where Frodo had his whole team around him to get him, like you have improved outcomes just by having a team around you.
Wow. And so Paul always had Barnabas or somebody with him, right? And then he talked about us being co-laborers together in the kingdom. So we were made for each other. That's one of the ways, as you said, COVID has really distanced us. So you've got a virtual community there where we can read other people's stories, share our stories, ask our questions, get answers from people just like us, from a nurse practitioner and others. Yeah. So it's richmondfunctionalmedicine.com. The contact form there is you can go to and ask questions to Dr. Hartman. I'm just going to go out on a limb here for my friends in Wyoming and California and other places that don't live near Richmond, Virginia. I mean, do you practice telemedicine also, so you can do some consults?
I actually haven't. I'm so busy with my boots on the ground.
How can we, if I live away from Richmond, how can I find somebody who's practicing functional medicine? Is there a listing or something?
Yeah, probably the best resource would be the IFM.org website, Institute for Functional Medicine, who's kind of like the biggest one, best known institute for that. Their clinic was sponsored at the Cleveland Clinic. So that's like, the big one. Yeah, exactly. So
if I go to ifm.org, I can find somebody like yourself who's practicing functional medicine near me.
You put the zip code in, they'll give you an idea who's close to you.
Sweet, man. That's a great resource. Yeah. Dr. Aaron Hartman, richmondfunctionalmedicine.com is the website. Dr. Hartman, our Faith Positive Nation always wants to hear from our guests about their favorite Bible verse, Bible story, Bible passage. Man, there's a whole bunch of them about healing. Which one's your favorite?
Actually, one of my favorite, I have so many favorites, but today I was reading, I think during the season of my life, my favorite one is from Proverbs. He who faints in the day of adversity, his strength is small. And it just, the reason that kind of resonates with me is just with all in my profession, with all the COVID stuff, just, like my profession, it's like a firefighter who trained to run into a building. You train your whole life for that building to be on fire, and the building's on fire. You're like, it's a big fire. I'm going to wait this one out. It's like, it's like the way you know what people are made of is when adversity happens. And the one who faints in the day of adversity is strength and small. And I've meditated on that passage for years and years and just kind of forgot about it until actually rereading it this past week and realizing that, I'd have a conversation with my wife about, what we're called for. And when, if you feel like we have a calling, when that struggle comes, that's an opportunity for you to actually live your calling out in full view of everybody else, of the rest of the world. And so, when COVID hit, our office never closed. We stayed open the whole time.
Wow.
So we just felt like we had to take care of our patients and our employees. We had to keep our employees employed. And so it was kind of like we felt as a practice as part of our calling. We have like 60 plus employees at my office. So it's a pretty decent sized office.
A lot of families depending on you.
Yeah.
Wow. You remind me of the passage that was a part of my devotional studies this morning. And that was when Paul had the demonstrated thorn in the flesh. And he prayed 3 times, and the Father said, "My grace is sufficient for you." But that concluding line where he talks about, in my weakness, he's strong, and that strength is made perfect in my weakness. I think that's the same kind of thing you're talking about there when adversity comes. Dr. Aaron Hartman is my guest today, Faith Positive Nation. richmondfunctionalmedicine.com is the website. Go there right now. Do yourself a favor and begin to live the life that the Father intended for you to live when he created you. Dr. Hartman, thank you so much. And thank Rebecca and your amazing family for the gift of your time and wisdom today. I know I'm better for this conversation. I'm sure Faith Positive Nation is as well.
Great. Well, thanks a lot. Really appreciate you inviting me and just having the time to talk with you and chat. So,
it's great. God's blessings on all of you.
Oh, thanks. Take care.
Thanks for listening to Faith Positive Radio, the Christian business coaching conversation that increases your faith with greater joy at work so you love God and others more. Suggest guests and ask questions when you email Dr. Joey at info@getpositive.today. And be sure to get your free gift of the 5 positive business conversations to have today coaching program at getpositive.today. Until next time, may God bless you with everything your heart can hope for and more than your mind can imagine.